Aleve is a nonsteroidal anti-inflammatory drug. Generic name Naproxen. Naproxen works by reducing hormones that causes inflammation and pain in the body. Aleve is used to temporarily relieve minor aches and pains due to arthritis, muscular ache, backache, menstrual cramps, headache, toothache, and the common cold. Aleve is also used to temporarily reduce fever. How to use? Don't take more than directed. The smallest effective dose should be used. Drink a full glass of water with each dose. Adults and children 12 years and older. Take 1 tablet every 8 to 12 hours while symptoms last. For the first dose, you may take 2 tablets within the first hour. Don't exceed 2 tablets in any 8 to 12 hour period. Don't exceed 3 tablets in 24-hour period. Children under 12 years ask a doctor. Contraindications. Aleve may also cause stomach or intestinal bleeding, which can be fatal. This condition can occur without warning while you are using Naproxen, especially in older adults. You shouldn't use Aleve if you are allergic to Naproxen, or if you have ever had an asthma attack or severe allergic reaction after taking aspirin or an NSAID. Ask a doctor before giving Aleve to a child younger than 12 years old. Ask a doctor or pharmacist if it is safe for you to use this medicine if you have heart disease, high blood pressure, high cholesterol, diabetes, or if you smoke. A history of heart attack, stroke or blood clot, a history of stomach ulcers or bleeding, asthma, liver or kidney disease, fluid retention, or if you take aspirin to prevent heart attack or stroke. Warnings. You shouldn't use Aleve if you have a history of allergic reaction to aspirin or other NSAID, nonsteroidal anti-inflammatory drug. Naproxen can increase your risk of fatal heart attack or stroke, especially if you use it long-term or take high doses, or if you have heart disease. Even people without heart disease or risk factors could have a stroke or heart attack while taking this medicine. Don't use this medicine just before or after heart bypass surgery, coronary artery bypass graft. Get emergency medical help if you have chest pain, weakness, shortness of breath, slurred speech, or problems with vision or balance. Avoid drinking alcohol, it may increase your risk of stomach bleeding. Avoid taking aspirin or other NSAIDs unless your doctor tells you to. Aleve side effects. Get emergency medical help if you have signs of an allergic reaction to Aleve, runny or stuffy nose, wheezing or trouble breathing, hives, swelling in your face or throat, or severe skin reactions, fever, sore throat, burning eyes, skin pain, red or purple skin rash with blistering and peeling. Stop using Aleve and seek medical treatment if you have a serious drug reaction that can affect many parts of your body. Symptoms may